Hello there. My name is Ariana Stark, LPN. I'm an Indiana State University student in the LPN to BSN program, and this is my stroke education health presentation. What is a stroke? A stroke is a term used when the brain is damaged due to a problem with blood flow. There are two different types of strokes. The first type of stroke is called a hemorrhagic stroke. And a hemorrhagic stroke is when an artery breaks open and starts bleeding into or around the brain tissues. The second type of stroke is called a thrombotic stroke. A thrombotic stroke is when an artery going to the brain gets clogged or closes off, which causes that part of the brain to go without oxygen, causing brain tissue ischemia and death. How do strokes affect people? Sometimes, depending on the region of the brain that is affected, a person may have no lasting effects from their stroke. This is also affected by how quickly the stroke is treated, whether the hemorrhage is stopped or the clogged artery is unclogged. Stroke is the leading cause of death and disability in the entire world, just because of how quickly it progresses. And time is really the biggest factor in how someone is affected by a stroke. It's how quickly can we get that hemorrhage under control and how quickly can we bust that clot. Along with the area, those are the three main components of how someone is affected by a stroke. How can you tell if someone is having a stroke? Well, there is a little acronym that was created called Be FAST. This will help you recognize the effects of a stroke. So B stands for balance. That would be any loss of balance or coordination, headache or dizziness. Any effect on the eyes, which may occur with blurred vision, loss of vision, or double vision. Any effects of the face, which may include one side of the face drooping, or it may just be numb. You may notice arm or leg weakness or numbness. This is typically unilateral. You may also notice that their speech may be affected. It may become slurred or garbled. The person may have confusion or trouble understanding the words, and their words that they're speaking to you may not make sense. And lastly, time. Like I mentioned on the last slide, it is crucial that an ambulance, 911, is called immediately so we can stop that hemorrhage or bust up that clot. And this little graphic was taken from https://www.nhs.com/stroke-tech-care/. Diagnosing hemorrhage and thrombi. There are several different testing mechanisms that we can use to diagnose somebody with a stroke. The most effective, though, is called an MRA test, or magnetic resonance angiography. A CTA can also be used, which is a computed tomography angiography. Catheter-based angiography with 3D imaging can pinpoint the location of the aneurysm. Ultrasound imaging to show the location of the aneurysm or damaged vessels and the surrounding tissues may be used. How are strokes treated? With a hemorrhagic stroke, You're going to want to treat that patient to reduce the damage caused by bleeding. Very quickly, we're going to want to stop or decrease that bleeding and stop the medications that may be associated with that bleeding. Sometimes the patient may need surgical intervention to stop that bleeding. The surgeon may go in there and clip the bleeding vessels to stop the bleeding. With a thrombotic stroke, you're going to want to use treatment to help reopen those blocked arteries. And the patient may also start new medications such as aspirin or Plavix to help prevent new clots. Sometimes when somebody has a stroke, you may hear it called a TIA. And what exactly is a transient ischemia attack? Well, it's like a stroke, but no damage to the brain is actually done. A TIA occurs when an artery is blocked, but it clears on its own. You can see right here in this picture that the clot has started to block these arteries at the point of bifurcation. However, due to the turbulence of the blood, it does start to break up and it does go down the separate bifurcations of the vessel. That's something you would consider a TIA. It's not a full blockage, it is not a persistent blockage, and it relieves itself on its own. How do we promote stroke prevention? There's a few different ways, mainly through lifestyle changes and medication. Some lifestyle changes that would need to be implemented is smoking cessation, regular exercise, weight loss, eating a balanced, nutritious diet, a sodium reduction in typical meals, and you'll also want to limit alcohol consumption. Medications that are particularly important include any kind of blood pressure medication, statins to lower cholesterol, and then if somebody has had a thrombotic stroke, you'll typically see the implementation of blood thinners. And then anti-diabetic medications are also important to help control a patient's diabetes. And here are some of our resources local to the Dayton area. We have Premier Health, located at Miami Valley Hospital, which focuses in maintenance, care, and support groups for people with strokes. There are 2 links here to their neuroscience education support services. There is also Home Care Dayton. This is a company that focuses mainly on stroke management in a person's home. Their main goal is to get a patient home post-stroke to the best of their abilities, and they will support that patient from their home. There's a phone number and a website also listed. And then a general worldwide, countrywide organization is the American Stroke Association. They focus on stroke management and life after stroke education. You can also find support groups through the American Stroke Association. And there is a link right there for the American Stroke Association support groups. Again, my name is Ariana Stark, and thank you for taking this time to learn about stroke education.